Happy Tuesday, everyone. Welcome to what is the name of this webinar? What most dentists get wrong about sleep. I want to thank you all for joining us. I know there are 8 trillion other things you could be doing on a Tuesday night. So the fact that you've opted to join this esteemed panel of experts to focus on this topic is much appreciated. Your commitment to your patients, your practice, and the dental sleep profession is truly admirable. The 3 panelists who we're going to introduce in just a moment here are 3 dentists who 2 of the 3 have bustling restorative dental practices while also treating a lot of sleep patients. The third one, Dr. Doucette, they're over on the right. The third one, Dr. Doucette, up until not too long ago, had a bustling dental practice and now has a sleep and TMD only practice. But these are 3 people that have that are walking the walk, doing the thing. They've been where you're at, and they're now where you want to be. So this is an opportunity for you all to really hear, sort of the path that they've walked, so you can follow in their footsteps. They also, all 3 of them, lecture extensively. So not only have they experienced success and failure and more success in their own practices, but they've seen a whole lot of what works and what doesn't, and all across the country. So this is an opportunity for you to learn from them, and we'll spend a second introducing each of them. But before we do, I just want to say to each of you, thanks for being here. I know your schedules are packed, and the fact that you've opted to be here and share your knowledge, wisdom, and experience is much appreciated. So JT, John Tucker, we'll start with you. You're an Erie, PA, and you lecture a ton, you have over the years. But if you don't mind spending 45 seconds or so kind of sharing with everyone why they should be listening to you here.
Oh, that's a good one, JT. Thank you. Welcome everybody. I don't know. I've always just said I'm just a guy from Erie, PA, and I'm really super passionate about sleep. My saying is, when the sleep bug bites you, you're done. Aaron and Jason, I have been on the same journey that I've been on, and I'm honored to be with the 2 of them, as well as with you and Elias. We've all been doing this a long time. I've been in the trenches. I do walk the walk. I don't talk the talk. So sit back, have some fun with us tonight. It's going to be very low key, not a lot of science. If everybody's had a day like me, my brain is shot, so I couldn't remember anything. Aaron, I know that you've had a very arduous day. So yeah, let's move on.
Thank you, JT. And E3, Dr. Aaron Elliott, it was questionable whether or not you're going to show up. You showed up about 30 seconds before we went live because you've had a hectic day in the practice. So yes. Why don't you, and you are, I mean, you know this, well, maybe you don't know this. Everyone else doesn't know this. You are my DSM BFF. So thanks for doing this. And you want to tell everybody a little bit about why you're qualified to share what your expertise is?
Well, I've been a dentist here in Post Falls, Idaho, way up in the northern part of Idaho, for 21 years now, and got the sleep bug in 2008, 2009, when I discovered dentists could be a part of it. And I just love to sleep myself. And it's just amazing to me how many people struggle with it but don't know it. And like, my favorite part of dentistry, and except for this afternoon, is the problem solving. I think every one of my quick exams today all had a problem I had to try to solve. But it's almost like detective work, and to take all of these signs and symptoms that patients have and put the clues together and talk to them about their story, and not just like they're another number, helping them discover that maybe what they think is normal isn't. And so that's super, like, gives you that professional satisfaction, even though I just did some amazing class 2 composites, the best ever. There's nothing like giving someone a better night's sleep. And actually,
Yeah. Mhm.
I met my DSM BFF, Jason, hit it off immediately at a lecture where John Tucker was lecturing next door. So
Yes, yes.
had to
And
all together.
yes, and Dr. Elliott, the first time that I found out that what was normal to me was abnormal was when I first met my in-laws. And it's like, oh, this is what a normal family looks like.
Yep.
Yeah, so it comes in all facets of our lives. Dr. Doucette,
Yes,
Jason, my
yes.
fellow my namesake, we've broken bread together, eaten a lot of pizza together, shared some great meals. And
Yes.
you have recently transitioned from restorative dentistry with while doing a lot of sleep to sleep and TMD only. Yeah?
Yes, that's correct. 6 months. It's been a long time coming, and I'm still 1 day a week at my old dental office, just trying to transition out. So yeah, but the sleep and TMD practice is open 4 days, just full turkey, and it's just crazy how busy we are. And if anybody knows the numbers and the prevalence of OSA, right, among adults in the nation, the world, there's no way all of us that are practicing dentists could even, we can make a small dent in the people that are suffering. So we just need so many more to help us. It's amazing. So
Yes. Well, hopefully you can impart some of your wisdom today, and I'm certain you'll inspire some of the attendees. Before we dive into the questions, all right, Ellis, if you want to go ahead and bring that back up. But before we really jump in, just a quick housekeeping matter. We're going to end no later than 3 minutes after tonight. You can type your questions in down at the bottom. We'll try to answer them in real time as we move through the content. And then if you stay on until the end, we will email you your CE certificate within the next 48 hours. Don't email me in an hour going, where's my CE certificate? You'll get it in the next 48 hours. If you don't have it by Thursday night, then sure, shoot me an email. We'll make sure you get it. With that said, thanks again to all the panelists here. You are, this is a veritable Mount Rushmore of dental sleep I'm looking at. And the fact that you've opted to spend Tuesday night with all of us is much appreciated. So let's dive in. There were a lot of questions, surprise, surprise, about medical billing, right? This is a topic that of all the lectures I've attended over the years, dental sleep lectures, everyone is there because they have a healthy sense of altruism, want to help their patients, right? Nobody cares about the money. But when I talk to dentists that abandon their dental sleep journey, it's always because they're not getting paid. So there were a lot of different questions that came in about medical billing. We summarized it all with, what's the deal with medical billing? So let's start with you, E3, with Dr. Elliott. Medical billing. When should I get a third-party biller? When shouldn't I? Let's start there. What should you get a third-party biller, and what's the benefit?
Just to clarify too, the E3 is Erin Elizabeth Elliott. That's where that comes from.
Yes.
But I think you should get a medical biller from the start. When I started, medical insurance had no idea what to do with E0486. Always shoot us into the dental department. Sometimes they still do. Our consultant at the time was like, oh, you can do this. Lost thousands of dollars trying to figure it out ourselves. If I had just started with a medical biller, it would have saved a lot of heartache. One of the things that I think one of the most important personality characteristics you have to have is, well, people say I'm competitive. I don't think I am. I just really want to do my best. But you kind of have to have this determination that the medical biller or the medical insurance is not going to win. We followed your policy. We did everything you said, you will pay us. Now, there are some times that you may want to stay out of network, like it is a whole different language, but just learn the language. And a medical biller can do that for you. medical billers that only do dental sleep medicine have contacts with the insurance to get credentialed if it makes sense to get credentialed. It makes things way easier and more straightforward. They know what the allowable is going to be. You have to learn some of this language of allowables and out of pocket co-insurance, those types of things. It is possible to get paid. We do about 95% medical billing. And we do even teach fee for service. You'll get some yeses. You just won't get as many.
Yeah. So to summarize, well, first of all, Dr. Bruce Hurd just said he's seen some of your pickleball posts and you are undoubtedly competitive. Bruce Hurd, thanks for stealing the words out of my mouth because that was going to be my quip. So just to summarize, third-party biller from day one, they know the machinations of the medical billing, or I'm sorry, of the medical payers. They stay abreast of that. You should probably learn some of the basic terminology and have, sort of a silhouette understanding of what's going on, but defer to what's that?
There's a formula you can have and you could just practice. I'm really big on like role play and practicing things. So if you come in, you'd give the best consult of your life. The patient's like, I need this. And you come in, you're like, well, I think it's gonna pay this. And I think, your out of pocket could be this. There's a simple formula to figure out what the out of pocket is. Practice on your friends and family, get some confidence in it. And like I said, the medical biller can help you do that by doing this for hundreds of other dentists.
Yes. They've got the experience. JT, what about yourself? Medical biller, do it yourself?
100% agree with Aaron. I dipped my toes in the dental sleep space in 2006 with the late Ed Spiegel. Back then, nobody knew anything about dental sleep medicine, oral appliance therapy. My first person that I hired was a medical billing expert. She actually still to this day writes textbooks on medical billing. And I use the analogy of an accountant. I don't know tax law. I know some of the language, as Aaron alluded to. I think we all have to have a basic understanding of what we're billing for, know what you're billing for. Because when you file your tax return, it's your EIN or social security number that goes on that form. Yes, your accountant filled it out, but you're liable for that information. Same thing with the medical billing companies. They might bill for you, but it's your NPI number. So I hope you know what the heck you're billing for. Start out from the gate with a dedicated director of your dental sleep team and with a medical billing company that has honesty and integrity, but know what you're billing for, know what it means, know what those codes mean. Like I said, ultimately, it's your NPI number that's being used.
Great advice. A question just came through. We don't have any sponsors on our webinars, but a question just came through. JT, is there a third-party biller you would recommend?
I highly recommend Pristine Medical Billing. When I do speak,
that was 3 thumbs up there.
I only speak about those individuals that I use in my practice. Excuse me, I'm not a hired gun by anyone. Always like to say nobody owns me.
Sure.
Pristine's great.
They'll coach
they'll coach you, you said, E3?
your team. Yeah.
Yeah. And a couple of comments just came in suggesting Pristine is the way to go too. So, Elias, why don't you throw Pristine's contact information in the chat? And again, Pristine Medical Billing, Randy, the owner, great friend. He is, I often joke that he's the oracle of medical billing. He's incredibly knowledgeable, as is his team. They place customer service first. They're not paying us a dime. They don't even know we're talking about them. And if I told Randy, when I tell Randy tomorrow that we spent 3 minutes talking about his company, he'll go, "Oh, it's great, thanks," and that'll be it. So
Well,
I've got
I always ask him, I'm like, how do you keep, like, I get so frustrated if I was in his position. And so often patients want to blame our office, or it's really the medical insurance. So I even coach the patients, hey, be patient with us. But I wanted to add, there's a lot of times I get questions from other dentists, haven't attended my course, just want to ask me for advice. And they're like, I have this medical biller, this medical billing company is terrible. This medical billing company is terrible. Which medical billing company should I use? And I'm like, there's a common denominator here. It might not be the medical billing company. And so
yes.
just wanted to throw that out there. If there has been problems with Christine, I would talk to Randy directly and really like kind of get to the story. There's they do everything above board and do a really nice job. So just want to point that out.
Yes, they do. I agree with everything you said. And we do hour-long webinars on medical billing. We could do full day webinars on medical billing, but we've got more questions. So Jason Doucette, what is the deal with appliance selection? There were so many questions. You know what? There must have been 3 or 4 people whose question was simply Herbst appliance? Question mark. I don't know exactly what that means. Hopefully those people are on here and you're going to speak to them. But appliance selection. What if you don't mind sharing, what 3 devices do you use most frequently? And briefly, what criteria do you use to delineate which of those devices you're going to use?
Gosh, that's a big question.
Go.
So I think initially to answer, just like most clinicians that are doing sleep at any level, so to speak, the tried and true is just a Herbst appliance. I mean, we're getting more lateral or a little more leeway with PDAC approval on certain devices, but the tried and true seems to be the Herbst. There's a decent amount of lateral mobility. They're durable. You can adjust them, unilaterally. They take a good beating. There's companies out there that'll give you now a 3 to 5 year warranty on them. Unlike just the old days, I say the old days, years ago, when you just had like Narval and Panther that you could run over with a mega truck and it wouldn't crush it. So you can have a 20-year warranty. But so I'd say the Herbst is one. I do like the Avant that SomnoMed makes for a number of reasons. Tons of lateral mobility. It's not the perfect appliance, but it is comfortable. You said 3, so those are the
Dig deep in your bag of tricks.
I know. Well, I was gonna throw out like an upper Farrar type of appliance. So that's not really I don't know if that's an oral appliance. It's kind of in the TMD world for someone that just needs
to
stabilize the mandible without locking them in. I use a lot of those with TMD and sleep, depending on what's going on. I've used a tap a few times, the Dream Tap, not a bad appliance. Patients don't super love it all the time because of that anterior connection, but I will tell you that if I get a patient that doesn't have any posterior teeth or has few posterior teeth, but all the anteriors, where I don't need to worry about the connection going all the way to the posterior on, in the buccal corridors, that's a great appliance because the connection's in the front. So that works really well. And again, lots of lateral mobility with that appliance. But I think there's so many things to consider, depending, and really, from, a patient's dexterity, how big is their mouth? Are they okay with something that has some kind of metal in the appliance versus no metal? Allergies, durability, is someone a bruxer, a clencher? How many teeth do they have? Just so many things to consider. But I think at the end of the day, like when we teach this part of the lecture, when I do courses, is I just tell, all the attendees, try a bunch of these appliances across the board, because you'll find, like I don't use dorsal fin appliances that much anymore. I don't I've kind of been bit by those a number of times where I've locked patients in, and someone who had no signs of attrition, wear, clenching, grinding, nothing, would come back after 6 months or a year, and they'd snap one of the, the shark fins off or something, or crack them. And or I'd have more TMD side effects, but that may not be the experience with, with Dr. Elliott or Dr. Tucker. So I think try the appliances on yourself, your team, and family members. See what works in your hands, what you like to adjust. And at the end of the day, there's so many options now. It's so crazy how many appliances are out there. So
Sure.
but those are probably the top three, I guess, that I would use.
Got it. Aaron, Dr. Elliott, what would you add to that?
I kind of try to keep my menu small, like,
Sure.
In and Out or something, not like a TGI Fridays or Cheesecake Factory.
Cheesecake Factory. Yeah, yeah.
So I kind of stick with the three main companies, and then here's my thought selection. First is, unfortunately, I have to look at insurance, because you may have to follow what's called PDAC, and that's where you have to make a HERPS or a TAP. And I'm one where I don't ever make a TAP. For my personal experience, it inflamed my joint quite a bit, but I look at their insurance. The second thing I look at is the amount of teeth. I do practice in Idaho. The third thing I look at is their wear pattern. They're telling you where they want to go. And so if they have flattened posterior cusps, flattened canines, give them that side to side. So even if they don't have to follow, PDAC, I'll give them a Herbst. And like Jason said, you get such good unilateral control if they have a muscle flare up that's unilateral or anything like that. So I do Prosomnus, Somnomed if they don't have enough posterior teeth, and then Panthera for people that just break everything. You could run it over with a Mack truck, like Jason said. So that's kind of my thought process: insurance and wear pattern and amount of teeth.
Gotcha. Let me switch gears on you. We're going to stick with you, E3, because the recency effect. You just experienced this, kind of rushing to join us tonight. All three of you have general dentistry practices. All three of you treat a lot of sleep patients, but you're doing drill and fill dentistry as well. And something that I've heard from so many dentists over the years, and you've likely heard it as well in your lectures, is some version of, I don't have time for this. The hygienist gets put back 45 minutes, and the day gets blown away. The schedule gets ruined. E3, I mean, how do you make time for this in your schedule? This all sounds great. How do you do it?
It was an evolution. Now I wanted to work 3 days a week because of travel schedule. And I have a sleep champion that's a dynamo who does the lion's share of the work. And so we kind of do it in between my dentistry. But at the beginning, if you're so busy, you're not making time for something that's important to you. What are you busy with? Like occlusals? Yeah, I know occlusals need to get done, but you really need to set aside the time and be strict with it for you and a team member to really dial it in to get the workflow so that you don't have to micromanage or be on top of it so much. So when I first started, we did all of our medical consults on Thursday afternoons. And, with cleanings, you kind of have to accommodate the patient schedule a little bit. With something that's more medical, they kind of come when you tell them to. They make time for it. So we did Thursday afternoons, and then pretty soon it was all day Thursday, and then it was all day Thursday and half of Tuesday. And then my sleep champ and I got the workflow enough that I just kind of took her from chairside, just let her do sleep full time. And we just have a whole column dedicated to sleep now, 4 days a week. So that took time. Didn't happen overnight. I would say in this time, with as many people that are figuring out the workflow to learn from our mistakes or our evolution. You can be fast forwarded with that. In addition, with as familiar as medical insurance is now with E0486 K, the K code, they're a little easier to deal with. So that journey may happen faster than it did for me.
Got it. JT, what about yourself? How do you carve out the time, make this a reality in your practice?
It's a great question, and Aaron had some great answers. I think Aaron, Jason, we've all been on the same journey for about the same amount of time. There's nobody, unless you're with a DSO or you're an associate, there's no one that tells you what you can and can't do. I mean, your state board can tell you what you can and can't do, but if you want to do sleep, you've got to have fire in your belly. If you don't, that's okay. You made that decision. If you want to do implants, that's great. Whatever you choose to add, whatever vertical to your practice that you want to add, you can do it. But you have to be 100% committed to making it happen. It won't happen overnight. It's not a turnkey solution. Those things that are pitched that everything is turnkey and you're going to be doing a 50 appliances a month, that's a freaking lie.
Did you hear that, everyone? That's a
Turnkey is
freaking lie.
four-letter word.
Yeah.
I mean,
Yeah.
sorry guys, that's reality. So if somebody's telling you something like that, my famous four-letter word, next. So anyway, I'm not a lot different than Aaron. I started with Fridays. I now have a dedicated sleep director of the sleep practice. I have Erie Dental Sleep Therapy. Devin runs that. Tammy, that was my clinical chair side assistant, is now my full-time sleep liaison. There's dedicated rooms just for the financial end of it and coordination and the clinical end of it. But that didn't happen in a month or a day. It's taken years. So
You had to be disciplined through an evolutionary process.
Mhm.
Yes?
100%.
You had to be tenacious
Mhm.
and persistent.
Jason, I fought tooth and nail. And like I
Yeah.
said, when I started, there were no pristine medical billings. There were no companies that would get you into a DME. I paid somebody $10,000 to get me DME status because nobody knew how to do it.
Yeah.
People don't want to
And-
do that. If you don't want to do that, I get it. But now we've evolved to where companies like Pristine will do the DME for you for a reasonable expense, and you don't have to spend 10 grand.
For like a few $100 or something
Yeah.
like that, $1,000 or whatever. Yeah.
But you know what? I'm not a quitter. I'm a fighter.
Yeah.
And
Yeah.
you're either going to do that or you're going to lay down and say, "Oh, that stupid sleep crap doesn't work." And we
Yeah.
hear that all the time. So don't
Mhm.
blame the system or the appliance or the medical biller. Take a hard look in the mirror at who you're dealing with, because it's you that fails. It's not the system. So
But the flip side,
buckle up, Buttercup, and if you want to do it, do it. If you don't. But don't blame someone else because you don't have the fortitude and desire and drive to do it.
wow. I agree with everything you said. I think probably some feelings just got hurt, but you speak the truth, my friend. With that said, I want to take something you shared a step further. Look in the mirror, basically look in the mirror, you're the problem. But the flip side of that is look in the mirror, you are also the solution.
100%.
So, if the time to do this evades you, it's because you don't make the time to do it. Well, fortunately, per each of your what you've shared is that with some discipline and some boundaries and commitment, you can address that issue. So you're the cause of the problem. You are also the solution. And one thing too, one of the reasons I really wanted to have you all on here, it's sort of embodied in this quote. It's from Jim Rohn. And Aaron, you kind of touched on this. The quote is, "It's important to learn from your mistakes, but it is better to learn from other people's mistakes, and it is best to learn from other people's successes. It accelerates your own success." So that's really why you three are here. And what I hope everyone that's on here, after they wipe away the tears from JT's last comment, I hope that they see that and they go, you know what? You're right. These people have been there. They've done that. I'm learning from where they've seen others screw up, where they've screwed up. And now I can learn from what they've learned about success and take this and march forward. And to each of their point, not to pull some old man stuff here, but hey, back in the day, back in the day, it was a lot harder. There wasn't a code, right? Home sleep testing was like voodoo. And now there are so many resources, and the field is more favorable to dentists than it's ever been. So there's a huge opportunity here. But to everyone's point here, there will be some struggles, there will be obstacles, but all of them can be overcome. And how do I know this? Because these three have done it. And if anyone has done it, you can do it. So I want to move on to this next question. This is for you, Jason Doucette. If you can lead with this. I hear a lot about this. What's that?
I don't get the fun ones. You can have fun ones. It's all good.
You can have some fun with this. Oral appliances are held to a different efficacy standard than other treatments. Inspire, different than oral appliance. And there's all this debate about the validity of AHI. Can you just talk a little bit about what your experience has been with this, how you measure success, and how that might differ from other treatments or insurance?
Okay, so what do you mean by insurance? Define what you want me to hit on in that realm with insurance.
Just go. Just take it. Shake it, don't break it.
So I think at the end of the day, when we're treating sleep, this is not an exact science, right? We have the AHI, the RDI, all those acronyms, and those are definitely objective metrics, right? But we're still treating a human being. So it comes down at the end of the day for, the patient sitting in front of you, improving quality of life, right? Most people aren't worried about dying early, even though everybody knows when we start to educate the patients that we're trying to prevent some cardiovascular event, heart attack, stroke. But that doesn't motivate a lot of people. Some it does. Every now and then you get some OCD patient that goes, "Oh my God, I'm choking at night. I have sleep apnea. I heard it's going to kill me 20 years early." And they're freaking out and they're like, "I don't care about insurance. I want the appliance now." And then you go, "Well, it's X amount if we're not using insurance. Okay, let's pre-authorize insurance. I can wait." So you go down that road. But I think, we're on the science end, yes, we're trying to look at this AHI that gives us a snapshot of what's going on with this patient at night while they're sleeping, choking, et cetera, and all the signs and symptoms. But for us and me, we're treating the objective and the subjective, right? The symptoms, the chief desire, that's what motivates the patient to move forward regardless of cost. Is if their main thing is literally, which is for us in the field, snoring is a bit of a big deal, but for some, that's it. That's all they care about. I just want to sleep back in the bed with my husband or my wife. So if that's it, that's what we're going to aim to treat. But underneath it, and along with it, we tell the patient, hey, when we do a sleep study, if we're going to find out what else is going on, and the more deadly thing and the more important thing is your sleep apnea and your events and maybe some other signs and symptoms. But we always try to focus on the main things that they desire, because that's what's motivating them to move forward in this treatment and to accept wearing this weird thing at night that no human being is used to wearing in their mouth, or a mask on their face. But both therapies work amazing. So that's what we focus on. As far as efficacy standards, I think, I'm not sure exactly where you want to go with this, but
Well,
you know,
let me ask you this, Jason.
okay,
Hang on one sec, E3. Jason, let me frame this a little differently.
okay,
You've got a patient, hypothetically, 49-year-old male. Uh, let's say they've got an AHI of 50, and they're desatting to 80% a couple times, and they've been wearing an appliance, and now their AHI is 21, and subjectively they report that they feel like $1 trillion. They've lost 15 pounds. His wife says, gosh, he doesn't snore anymore. Life is great. But their AHI is still, I don't know, whatever number I said, 19 or whatever. So yeah,
yeah.
so they're not effectively treated, right? Well,
Well,
based on what you just said about, being a human being and treating the human, they probably were. But how do you deal with this? How do you communicate with the physician in that situation? With that
yeah,
patient, what do you say to their referring physician?
yeah. So it just depends. I've had physicians that will refer a patient with an AHI of, 11, and we get them down to a 6, and the physician goes, no, not good enough. They need to be below 5, and they're doing
Yeah.
great, and they don't want to do any other therapy. So they're the quarterback. I can't argue with that, and I have to sensitively, kind of dance around with the patient and say, well, it's up to you, blah blah blah. But back to your scenario, that patient, that's a huge success. I mean, this world is about maximum medical improvement. Like I said, this is not an exact science. So as long as the patient, for me personally, as long as the patient understands that with all the wins that they're getting and how they're feeling and sleeping, they understand that they still have residual sleep apnea or events that still that are putting them at risk for some cardiovascular event, maybe other things, and they're willing to accept that, case closed. I mean, the physician, they can go back to their physician even after we do the follow-up with the stats you just talked about. And the physician could say, this is not enough. You are not going to wear that appliance. You are going to wear a CPAP, or I'm going to send you for Inspire. And the patient still has the choice. And you tell the physician, go pound sand. I'm done. Like, I'm happy.
Mm.
And so, but the main thing for me is they need to understand their condition completely, regardless of just the symptom relief that they're experiencing, that there's still some underlying apnea going on. And I think that's the most important thing. But I also don't ever poo-poo the other therapies, CPAP in general, because it is an amazing therapy for a lot of patients. If they can wear it, the mask is fitted right, it's pressurized right, it's an amazing therapy that can take a triple severe apneic down to 0 events per night, and they can have all the, symptom relief you just mentioned and more. It's a great thing. Combo therapy as well. So
Sure.
so anyways, I don't know if that answers the question, but
Yeah, and that's very insightful. I appreciate you sharing. Aaron, I think you were going to add something too.
Yeah, so I had a patient, actually not overweight, that overweight female, go from 109 to 9, and the sleep physician said it was a failure. And she told me to pound sand. Well, it's interesting when it comes from a sleep physician, their standards are 5 and under, not even looking at oxygen, right?
Mm-hmm.
But a lot of primary cares, they don't even know what AHI is. So so if the referral comes from a primary care, then we're cool. But what's interesting to me, my goal is to get an AHI under 10 and oxygen above 90. Positional therapy, other things like that come into play, weight loss. But do you know what the efficacy for Inspire is? To be a successful Inspire patient, do you know what your AHI needs to be?
down by a
I
half.
did, but I don't anymore. No.
15. 15.
Mm.
They
Mhm.
moved the goalpost. For an oral
Mhm.
appliance, they have it set at 5. For
Right.
Inspire, all of a sudden it's 15. So how
Mhm.
can we fix this? I am announcing my candidacy to run for Congress of Idaho, and I'm gonna make this change.
Mm,
It's very frustrating to me, but I have a sleep physician that I work with during the courses in Raleigh that I teach, that he thinks every person should start with an appliance. And subjective symptoms are worth something. It's not just AHI. If it's not enough, then add a CPAP. With the combination, CPAP's a lot more tolerable. The number one reason people can't tolerate CPAP is usually pressures. So you can bring the pressures down.
Mhm.
I think the biggest problem we have right now is that everyone's working in silos. And if it's not this, it's that. Why can we not do several treatments, combinations, tongue ties, myofunctional, weight loss, positional therapy, nocturnal oxygen for loop gain, low arousal threshold treatment, all sorts of things. You could even do combination with Inspire. So I just think it's very frustrating that sleep physicians look at it as this or this or this and don't take the human into account.
Thank you for driving that home. Let's table that for a second. And you both mentioned Inspire, and some of you, actually probably each of you know Dr. Ryan Seuss. He is an ENT, and he and Dr. Nicole Chenet, who is a dentist in PA, will actually be talking about how Dr. Seuss, who is Inspire, he places Inspire implants. They'll be talking about how they work together because so many of the patients that come to see Dr. Seuss aren't candidates for the Inspire therapy. So he refers them to, when appropriate, to Dr. Chenet for an oral appliance. And one of the things that will be part of the symposium is the two of them presenting in tandem, sort of how they jointly manage that relationship and how they manage those co-patients. So that'll be interesting. And Dr. Elliott, you are presenting again at the 2025 Transform Dental Sleep Symposium. Dr. Doucette, Dr. Tucker, you aren't making it this year, but hopefully you both presented last year. Actually, now that I'm thinking about it, the three of you were on a panel together.
Yes.
Correct.
Yeah,
Yes.
this is like old time. The
Yes.
band's back together. The band is back together.
And I was the moderator.
Yes, Elias, and you were the moderator. Yeah, it's like old times. But the meeting is going on January 31st, February 1st, 2025. As you can see, we've got a veritable, who's who of presenters, everything from sleep physicians to ENTs to Randy Curran, the owner of Pristine that we mentioned earlier. We've got sleep champions, CEOs, world-renowned athletes, but all of these people will be presenting on practical, actionable information for dental sleep practices. So if you can make it, if you like nice weather in February, you should join us at the 2025 Transform Dental Sleep Symposium. You can register and learn more about the meeting at tdssymposium.com. And Elias and I didn't discuss this, but if you register by Friday with code JT100, you can save $100. I hope to see you there. Hundreds of people last year said it was the best dental sleep meeting they'd ever attended. So yeah, get registered. TDSsymposium.com. Let's keep it moving. Next question. John Tucker.
Yes, sir.
What steps can dentists take to mitigate side effects and specifically occlusal changes as a result of oral appliance therapy? Can they select certain devices? What about enamel liners, any of those things, exercises? What can they do to mitigate side effects?
You ready for my answer?
Go.
Who cares? Back when I started,
A bunch of dentists care.
Yeah, every
And-
dentist on here cares.
and Jason and Elias, JT, Jason, you guys didn't even exist. So, I mean, you were out of the birth and evolution of a need in the dental sleep space, and I thank you both for your contributions. Anyway, back when I started, I asked Alan Lowe. I said, Dr. Lowe, I said, I think this was 2006. I said, this really seems like something that's really interesting and needed, and I'd really like to get involved. Remember, I'm a prosthodontist wannabe. And I said, I don't think I'm going to do this because you're telling me the bite's going to change. And he's like, yes. I said, well, I'm trying to achieve perfect occlusion for every patient. And he looked at me and he said, get over it. It's a side effect. I was like, wow, that's pretty strong and rude. And I thought a lot about that. I want to read you something. Not many people, I think about this. This is from the NIH. 69% of medications have between 10 and 100, yes, I said that correctly, 10 and 100 different side effects. Nobody seems to care a lot about side effects with medications, but I'll tell you what, if somebody has occlusal changes with an appliance that Jason put in, or Aaron put in, or I put in, and their PCD, their primary care dentist, sees it, they push that fire alarm that we are lunatics and heretics because we've changed their occlusion. I've always said, show me a death certificate that says cause of death, bad occlusion. So what is the most important thing? Breathing, good quality sleep, or perfect occlusion? So am I a lunatic and a heretic? Probably. But I tell patients, look, I can't promise you that there aren't side effects. And I bring that up, what I just read to you, the 69% of medications have anywhere from 10 to 100 side effects. No one talks to the patients about those. And oh, by the way, those side effects can affect their sleep quality. And that's going to affect the way your appliance works. So are there appliances that appear to have fewer occlusal changes? I personally, my opinion is, herps have fewer occlusal changes. Why? Because it allows parafunction. So I think the key that we need to take away, my message that I want to leave everyone with, is I tell patients, just what I told you, medications have side effects. Oral appliance therapy has side effects. Inspire has side effects. CPAP has side effects. Understand the side effects before you decide on what treatment is right for you. I don't cookie cut my treatments. I offer oral appliance therapy. I offer Inspire, and I offer CPAP. I don't provide Inspire or CPAP, but I always encourage people to do that with everything Aaron said, all those different choices. So I think it's basically informed consent. Do I see a lot? Less than I saw when I started in 2006, because I think we have better appliances. Do AM aligners work? I don't know. Fernanda Almeida is a very close personal friend, as is Ryan Seuss. There are side effects. I've talked to Ryan about the side effects. He was part of our PIT program with Inspire. Fernanda was going to do a study on the AM aligner. Does it really work? Is it really needed? COVID threw the monkey wrench into that, and I don't think that's been published yet. So to me, it's a side effect, and it's the way we manage the patient's expectations. And I flat out say to the patient, if your bite does change and your primary care dentist freaks out and comes unglued that your bite's changed, are you going to be able to say to them, yes, I understand that was a potential side effect of wearing my sleep appliance. I'd rather have the bite changes and have good quality sleep at night.
Got it. Jason Doucette. I know that this is an area that you've dedicated quite a bit of time and quite a few resources to generating regular physician referrals. Can you talk a little bit about how you've done that? If you could impart, three key concepts to everyone as far as on this topic, what would they be?
Letters. Just like, it's all about real estate. It's all about location, letters. That's the way physicians communicate. So you just that's a big one. Just, naturally speaking, if you're sending letters to all the physicians that patients see that you're seeing to give them progress reports, that you're going to inherently just market yourself. So that's a big one. I think keeping if you're starting this up, keep your initial consultation, either complimentary or a very low fee. If you're going to dispense sleep tests, keep that fee low. Don't be absorbent about that. Again, and then I just think, patients having a great experience, definitely, billing medical insurance, that's huge because, I don't know that you necessarily need to go in network, but the fact that you're willing to bill for the patients, that's the big one. I think that I found, I did a lot of lunch and learns, and we could talk about that. I think that's something you do kind of after you get your feet wet, get some experience, some success, some failures, so you can walk in and talk to some physicians if you want about, your knowledge thus far. But the main thing that they will always ask, do you accept Medicare? Do you take medical insurance? So I would always start with that when I met with physicians, and I always left on that note, always. I mean, I sat with 3 physicians and had lunch for 45 minutes years ago, did this whole spiel, and I went to leave and I said, anybody have any questions? And they said, yeah, do you accept medical insurance at all? I mean, they weren't even paying attention. So I learned right away, hammer that in at the beginning and at the end, because they just want to know that when they refer to you, if they start referring or they send you one patient as a tester, they don't have to worry whether, you take the benefits that the patient has, and that's going to be a problem for the patient coming back and being frustrated. So that's a big, big one. And what we have had patients come back and say, or tell the physicians, is obviously if the therapy works, they had a great experience. And then we've had, when physicians have referred patients to us, the patients have said, they showed me a list of providers that I could go to for this treatment, but they pointed to your office and said, but if you go see these guys, they're going to get your insurance to pay. Boom, drop the mic. That was it.
Yeah.
So pretty big deal.
Yeah. What about, go ahead, Jason.
No, go ahead. I didn't want to go too much on that subject, but if you want, if there's anything else.
No, that's, and as far as the letters, I mean, is that something that you're using a software to generate, or how do you write or send those letters?
Yeah, so these days there's a couple different dental sleep medicine softwares out there. Like I think Dr. Tucker was talking about earlier, he started a little bit before I did in this, but when I started, there wasn't a whole lot out there. Some basic letters depending on where you kind of started your sleep journey. So over time we created some, but these days, I'm not sure about Pristine's EMR, but definitely Dental Writer, DS3. There might be 1 or 2 others out there that already have these auto-generating type of letters. Once you see a patient and you input all their basic information, it'll spit out, an intro letter that goes to all the physicians the patient sees about, the initial screening and what's going on and or their diagnosis, what's happening. And then follow-up letters, compares maybe a pre and post sleep test results, symptom relief, etc. Thank you for referring this patient, or just getting the information out to their other MDs. So though that is vital. I mean, that's the big one, I think, because there's, that's the only way other than word of mouth of, your community knowing what you're doing and treating and, that sort of thing, that I think those letters are just, you're going to start, I think naturally after you treat, 10, 20, 30, 40 patients, you're going to every now and then start to get a referral from a physician you've never heard of. And it's because of that. It's because of those letters, or a patient that was successfully treated going back to their friend or family member asking to be, be referred in or something like that. So
I'll coach the
Yep.
patient to talk to I'm like, you love us, it works. Like, make sure you tell your doctor.
Yeah.
I also find that functional medicine and nurse practitioners are much more willing to listen, and they really actually like that we do the home sleep test because it makes things smoother and more efficacious. And then the last thing they do, number one, care about medical insurance. I always lead with that too. But I also have had the chance to coach them about upper airway resistance and insomnia. and how we can help with that and why it happens, and use the word cortisol is kind of like a buzzword.
It's a buzzword. Yeah.
And I said, if you get a sleep study from somewhere else and they say that they're fine, but they're symptomatic, please still send them to us. We can help them.
Yeah.
Mhm.
If I can add to that, I'll just
Sure.
add to what you're saying, Aaron. Yeah, for sure. Those are your fibromyalgia patients. They've tested everything under the sun. They can't find anything wrong. They maybe done a basic sleep test. The patient still has all these symptoms. And of course, we know if we can look a little deeper at RARAs, et cetera, we can find that it's just an airway issue that gets
Mhm.
missed. And so I think that speaks volumes, like you said, to nurse practitioners, PAs, because they see a lot of patients, especially female patients, that have that issue, and they're just the diagnosis is just slightly missed.
Got it. We had another question come in from Haley that I think is really a good one for the three of you, because the three of you lecture so much, because the three of you are practice owners. I'm sure you've heard this, seen this, and I'd love to get your brief insights on this. Haley is an associate dentist, and she's trying to talk with the office owners about incorporating this into the practice. They don't necessarily see the value in it. Any suggestions regarding a talk track or what she might be able to do to get them to nudge them forward? E3, what do you got?
I started as an associate, and I had a consultant that told my owner that sleep apnea doesn't work, and that, just basically let her forget it. So it's that tenacity. I'm like, no one tells me what not to do. I'm gonna make this successful.
You don't sound
So
competitive at all. Sorry.
exactly. But so it doesn't take a whole lot of investment, truly, to start talking to patients. Yeah, I finally got him to invest in like the software, and I proved the concept. If you can get your owners to look at this as a business, right? And you have a startup, it's like, give me 6 months to prove the concept. I think so many dentists, you're on this, sleep is a little bit of a longer runway than implants, let's say. Implants I started doing the next week. But it's almost like we get this long runway, and just about as we're about to take off with sleep, people quit. They cut the engines, it doesn't work. So if you could ask for 6 months, even doing it on your own time, um, and then work out the production and payment and stuff after that, but by getting some wins. I don't mind talking to Haley personally too, because I started there as an associate, and seeing the value, maybe getting your doctors tested and treated.
Yeah. Hey, Haley, why don't you just shoot us a quick message with your contact information, and we'll put you in touch with Dr. Elliott. JT, any other words of wisdom that you might offer there?
Yeah, if she really has fire in her belly and her owner doesn't want to do it, go rent some office space somewhere else and do it. Start start 1 day a week. I mean,
Yeah.
I don't like people telling people what they can and can't do, and it doesn't make sense to me when someone doesn't see value in changing people's lives and assisting them out in having a better quality of life, because that comes back in spades. So
Sure.
figure out another way to do it. Go rent space 1 day a week.
Aaron, you mentioned you announced your candidacy for Congress in Idaho. I think John Tucker just planted his flag for Libertarian candidate for governor in PA or something. Jason, you were going to add something as well.
Yeah, I started out as an associate too when I got bit by the sleep bug. And so what I did is I approached my owner, who was a good friend. We had lunch every day together, and I came back from a sleep course, and he was asking how it went. And I go, this is amazing. I had no idea that people were suffering, what we could do for patients. And he goes, okay, well, what do we got to do? And I said, well, I need a little bit of equipment. We need some sleep tests, et cetera, et cetera. And he said, okay. He said, but you really want to do this? I said, yeah. And he said, okay, so I got to make a little bit of an investment. I said, yeah. I said, but here's the deal. you make the investment on the equipment I need, allow me to do this. You don't pay me $1 of a percentage of production until all of your investment is paid back 100%. And then I want 35% of everything I do. And give me the space to do it in the practice. And that's what he did. And the rest is history. And that was 10 years ago. So,
And you're still good friends.
Boom.
oh, we're still, yeah, he just came by the new office and he's about, he's almost 20 years older than me, but he walked around and we're like friends, it's not like, I mean, he's old enough to be my dad or anything, but he came by the new office and he walked around and he's like, all right, Jason, I'm kind of proud of you. And I go, hey, this wouldn't have happened without you. You're the one that support, you bankrolled the journey for me until we got rolling, and he saw the benefit and he was one of my patients, so he became a quick believer, and then the rest is history. So yeah, it's a pretty cool story. Yeah.
Love it. And we got Haley's contact information, so we'll make that connection. We're going to jump into the lightning round here. So the rule, if you're unfamiliar, is going to ask each of you one of these questions. You got 15 seconds to answer. That's it. All right. We got a wrap. All right. John Tucker, 15 seconds or less, 10 words or less. One piece of advice for all the attendees, everybody here. One thing. What is it?
Go change lives.
That's only 3 words. You got 7 to go if you want them.
Healthy quality of life.
Love it. Aaron Elliott, if you could use one device on your next 10 patients, which would it be? You've got 1 to use. That's it.
Oh, geez. The Prosomnus Evo Select.
All right. Jason Doucette, we've had numerous meals together, but what is your favorite cuisine?
Oh, there's no question. Italian pizza.
How you doing?
Period.
How you
What
doing?
about the flat? We didn't break bread, but we broke tostones together in Clearwater.
Right, we did. That's an exquisite little carved out cuisine for sure. But on a regular basis, I'd say the Italian food for sure.
How you doing?
What about you, JT? Favorite cuisine?
Italian, 100%.
All right. All right. Aaron, you were there last year. You're going to be back this year. What'd you think about the Transform Dental Sleep Symposium? Honestly.
I loved it. Just obviously our styles are very similar, but one of the biggest things is the practicality, but also having the perspective of sleep physicians and not just hearing from dentists. Dr. Singh might be I just want to put him in my pocket. It was just refreshing to hear from a sleep physician who actually understands what we do and what we're trying to accomplish. So a lot of practical takeaways for people.
Very cool. And JD, what'd you dig most last year?
Just the lineup of speakers, the information that came out, no holds bar. I think, having people up there that are not just research nerds, they're actually doing it in practices from the medical to the dental side. I mean, I don't know. It was just an awesome meeting. And obviously I'll be back, every year. So can't wait for the next one.
Love it. Love it. Well, this feels really good. So JT, I'm going to ask you, what'd you dig about the meeting?
You know what I liked about the meeting? First of all, it was spectacular. It was the Switzerland of sleep programs. Complete, no bias, no agenda, just people speaking the truth. And we need more of that in the dental sleep space. We need more of that in the world. So highly recommend it. It was
it's also the same weekend as the PPA Pro Pickleball Tournament in Phoenix, Scottsdale, right down the road.
Thanks for saying that, JT. That's one thing that we don't touch on a whole lot, but I think it's important. We don't have anything Transform Dental Sleep. We don't have anything to sell to dentists. We don't have a software. We don't have a billing company. We don't have an appliance company. We don't sell consulting to dentists. We don't have anything. We just want to provide an excellent platform with energetic speakers, knowledgeable speakers that are presenting information that's actionable, that helps dentists connect the dots and actually treat more patients. That's our aim. So I really appreciate you shining a light on that. But the Transform Dental Sleep Symposium is not the only upcoming dental sleep medicine event. Aaron, you want to spend a sec talking about some of your upcoming events and what this QR code will take viewers to?
I was gonna say everyone should buy your book too, because that's full of it makes you LOL.
Mm.
I
Well,
have
thank you.
I have a live course coming up at the beautiful 3D Dentist Retreat where you can choose to stay in the house, access to the mentors, get beat in ping pong, and we just really bond. It's pretty awesome there. So 2-day course, take a home sleep test, very practical. We also have I have an online version. We do spend a lot of time role playing so that you actually go back and do it and know how to talk to people about it. It's not just one research, topic after another. Lastly, I do have my advanced course, troubleshooting course coming out online. We've moved that to all online, and that should be out soon for that next level, next step in treating sleep.
Excellent. And I've been to a couple of your implementation courses, and they are excellent. They're very comprehensive, learn a ton, but also very practical. They're fun. And I haven't made it down to one in Raleigh, though, and I really want to because I want to check out that facility. But I encourage everyone to register for one of these events. And then, JT, you've got quite a bit going on, some big time jazz. You want to talk a little bit about collaboration cures?
Yeah, that'd be great. Thank you for the opportunity,
Yeah.
Jason.
Of course.
So Jeff Hinden and I put together a program with the University of Pittsburgh School of Dental Medicine. We just had our first class graduate, 83 hours of CE. It is live, hands-on, lots of science, but lots of practical use. The AAPMD has agreed to offer a diplomat status for those graduates of the PIT program and start a new diplomat program for anyone that has the qualifications. Those individuals that succeeded in achieving the proficiency certificate in the treatment of sleep-related breathing disorders from the University of Pittsburgh School of Dental Medicine will be honored at a ceremony at the AAPMD Collaboration Cures in Reno. Jason Doucette. Hope to see you there in September. So check it out. Jeff and I are really excited. Another avenue for education that's backed by a university. It is very non-biased, very science-based, and we have some really highly educated individuals that have come through that program. So be sure and check it out.
Love it. I love it. And then can you talk a little bit about THG Health Solutions?
Yeah, so Jeff Hinden and I got together and put our heads together and said, what would we like to do together? And let's help people change the way they think. So we have a comprehensive program that deals with sleep-related breathing disorders, deals with heart rate variability. Anybody that knows Jeff Hinden knows that he is the guru of heart rate variability. We kind of put that all together and teach people full mouth rehabs based on heart rate variability. Just change how you look at a patient. Patients aren't supposed to be your way out of debt or your next car payment. So we're trying to help get people to think outside the box, if you will, and look at the entire individual based on their specific anatomy and physiology.
Got it. And then Jason Doucette, you are taking a little hiatus from lecturing to focus on opening the new practice. Yes.
Yes, that's exactly it. It seems like that's slowed down a lot, which is good because I'm pretty pretty buried in a good way with the new office. So no complaints to stay home a little more and get a lot more wake surfing in, to be quite honest. So all is well.
Yes. And then we've got another webinar coming up in 3 weeks. It's on August 13th. It's called How Do I Get Patients? Branding and Marketing Your Dental Sleep Practice. So this is going to be Lane Rizzardini and Ryan Toe, alongside my business partner, my homeboy, Elias Kalanzis.
Yo.
They're going to focus on marketing. It's a topic not unlike medical billing, where too many dentists try to dabble in it themselves. They don't excel because it's not their area of expertise. It's not their core competency. And then they flounder, they flail, they fail, and they bail. So the key is to use a third party that excels in this area. And Lane and Ryan are really a wealth of information on this topic. And Elias is as well. So they're going to answer your questions on the topic of branding and marketing a sleep practice. You can get registered for that. It's free, 7 p.m. Central on August 13th.
Jason,
Also,
real
yes.
quick, I'm putting the link to register for that webinar
Yes.
in the chat right now. Okay.
Right on. I appreciate that, Elias. Everybody keep an eye out for that. You can click the link, get registered. It's free. But the information is priceless. And then also, we mentioned earlier the Transform Dental Sleep Symposium, January 31st, February 1st, 2025. What I didn't mention is that the day before the meeting kicks off, so this is January 30th, we're having a few deep dive workshops. One of them is going to be on the topic of medical billing. It'll be presented by the esteemed panel you see there: Randy Kern, Kyle Kern, Ryan Jovenbach, Monica Edwards, and Joseph Pinkava. And that is going to be a 6-hour deep dive on medical billing. To register for this workshop, you do have to register for the symposium, and you do have to also register for the workshop. This workshop is limited to only 35 attendees. So while there will be hundreds and hundreds of people at the symposium, this workshop is limited to 35. It's very exclusive, will be very intimate. It will give you an opportunity to learn from the oracle of dental sleep medicine billing in a small, intimate environment. So I encourage you to get registered for that. And then the symposium, again, is January 31st, February 1st. It will be bonkers. It is fun. It is informative. You'll learn more. If you take that information, I tell everybody, and just put 10% of it into practice, you will do more. And as a result of that, you will realize a higher level of life satisfaction. So you will be more. Learn more, do more, be more. TDSsymposium.com. I want to thank all of you. I see you on there, Tammy Bonenkamp and Paul Miller and some of my other friends. Mike Morehart, I see you. Thanks for being here. Every one of you, thank you for being here. We really appreciate you, appreciate the questions, appreciate your attention. John Tucker, Jason Doucette, Aaron Elliott, thank you. I know there's so many demands on your time. You've worked so hard for so long to develop this knowledge, this wisdom, this expertise, and for you to share it so openly and so freely is a testament not just to who you are to share this with your colleagues, but also I'd like to think it's a sign of our friendship, and I truly appreciate each of you. So thank you. Sincerely, thank you. Yes, I'm praying, holding it over my heart, because I mean this so sincerely. It means a lot to me that you would share so openly. Thank you. Thank you all. Register for their courses. Come to the symposium. Put this stuff into practice. Treat patients. Screw up. Fix it. Do better next time. But take action, damn it. It's on you. You're the problem. You're the solution. Make it happen. Blah, blah, blah. Just do it. And we're out.
Thank you all. Have a great night.
You.
Thank you.